They said it could not happen. Not in that body, not with that blood, not after what generations had done to the human form. And yet, in a quiet corner of America, far from polished hospitals and academic certainty, the first signs appeared. Subtle, unsettling, impossible to ignore. At first, it was dismissed as illness. The woman's body had always been fragile, shaped by a lineage that medicine rarely saw and never fully understood. She was small, malformed in ways doctors would later struggle to describe without hesitation. Her posture was uneven, her limbs slightly misaligned, her facial structure marked by inherited deformities that whispered of a family tree folded in on itself too many times. People who knew her spoke in lowered voices. Outsiders avoided questions altogether. Biology, everyone assumed, had already made its final decision. So when she complained of nausea, dizziness, and a strange pressure deep within her abdomen, no one thought of pregnancy. They thought of infection, tumors, organ failure. Some suggested hysteria, others quietly predicted death. Pregnancy was not only unlikely, it was, by all known medical standards of the time, biologically impossible. Midwives had seen countless births, but they had also seen bodies like hers, bodies damaged before birth by generations of genetic repetition. Such women did not conceive. Their reproductive systems were often underdeveloped, malformed, or non-functional. Many never menstruated properly. Some were sterile from birth. Others carried internal abnormalities so severe that survival into adulthood was considered remarkable, let alone the ability to create life. But the symptoms did not fade. They grew stronger. Her abdomen began to swell, not evenly, not gracefully, but with an irregular, almost disturbing shape. It hardened in places where it should not, softened where bone should have been. The swelling did not match known patterns of disease. Fever came and went, appetite vanished, then returned with violent intensity. At night she complained of movement, faint at first, like muscle spasms, then undeniable. Something was moving inside her. The first doctor refused to believe it. He examined her briefly, his face tightening as his hands pressed against her abdomen. He said nothing at first, only stepped back and washed his hands longer than necessary. When he finally spoke, his words were careful, controlled, and deeply uncomfortable. "This cannot be a child," he said. He explained that her pelvis was too narrow, her skeletal structure too compromised. Her organs were not positioned correctly. Even if conception had somehow occurred, which alone defied probability, the pregnancy could not progress. The body would reject it. Nature always corrected its mistakes, except nature in this case did not. Weeks passed. The swelling continued. Her heartbeat changed. Her breathing grew shallow, then irregular. She experienced sensations she had never known, sharp internal pressure, rhythmic tightening, moments of pain followed by eerie calm. The doctor returned, then another. Each arrived with confidence and left with doubt. One of them finally whispered the word no one wanted to say: pregnant. The room fell silent. Pregnant meant more than a medical anomaly. It meant a direct challenge to everything science believed about inherited deformity and reproductive failure. It meant that biology had not just bent, but broken its own rules. Tests were crude in those days. No ultrasounds, no advanced imaging, only hands, ears, and instinct. One physician pressed a wooden listening device against her abdomen, expecting nothing. Instead, he froze. A second heartbeat, slow, uneven, but unmistakably alive. Fear replaced disbelief. If the pregnancy continued, the risks were catastrophic. Her body was not built to sustain another life. Internal rupture was likely. Hemorrhage was almost guaranteed. And the child, if it survived, would inherit not just genes but generations of genetic collapse. Yet the pregnancy progressed. Word spread quietly among medical circles. Some dismissed it as error. Others traveled miles to witness it themselves. They came not out of compassion, but curiosity. This was not just a pregnancy, it was an experiment written in flesh. Each week that passed deepened the mystery. Instead of failing, her body adapted, organs shifted, bones strained but held. The uterus expanded in ways no textbook described. Pain became constant, but life persisted. There were nights when she screamed until her voice gave out, certain she was dying, and mornings when she woke calm, almost peaceful, insisting she could feel the child turning inside her, as if searching for space that did not exist. The doctors argued. Some believed the pregnancy should be terminated immediately to save her life. Others wanted to observe, to learn. A few, disturbingly, wanted to see how far the human body could be pushed before it collapsed. Ethics were blurred by fascination. What unsettled them most was not just that she was pregnant, but that the pregnancy appeared stable, too stable. Biology had not corrected the error. It had reinforced it. As the months passed, physical changes became impossible to hide. Her abdomen distorted her posture, pulling her spine forward. Walking became painful. Lying down was worse. She could not sleep without assistance. Her skin stretched thin, veins visible like dark rivers beneath the surface. Still, the heartbeat remained. Medical notes from the time, later uncovered and studied, described the case with language rarely used by professionals. Words like unnatural, unprecedented, and deeply concerning appear again and again. One doctor wrote a single sentence in the margin of his notes. This pregnancy should not exist, and yet it did. The closer she came to term, the more the tone shifted from scientific curiosity to quiet dread. If conception had been impossible, birth would be unthinkable. Her pelvis was malformed. Natural delivery could tear her body apart. Surgical intervention in that era carried its own death sentence. But even as the danger grew, there was no sign of miscarriage, no rejection, no spontaneous correction. Life inside her clung on with terrifying determination. Those who observed her began to understand something deeply unsettling. Biology does not always protect. Sometimes it simply continues. This pregnancy was not a miracle. It was a warning that the human body, when pushed far enough by generations of genetic repetition, does not always fail gracefully. Sometimes it produces outcomes so rare, so unstable, that science is left watching, powerless to intervene. As the final weeks approached, the woman herself became quieter. Whether from exhaustion, pain, or some deeper awareness, no one could say. She spoke less, ate little, often stared at nothing, her hand resting on her distorted abdomen, feeling movement beneath the skin. Inside her was a child that should never have been conceived. A life formed from a bloodline science already considered broken. A pregnancy that defied biology, not because it succeeded, but because it exposed just how fragile the rules of nature truly are. And soon the world would see what happens when those rules are ignored for too long. Long before the pregnancy stunned doctors, before whispers of impossibility spread through medical circles, the damage had already been done. It had been done quietly, patiently, over generations, inside a family that lived apart from scrutiny, hidden by geography, poverty, and silence. What shocked science was not born in a single lifetime. It was inherited. The bloodline traced back to a remote rural region where isolation was not accidental but absolute. Roads arrived late. Outsiders rarely stayed. Families intermarried not out of malice but out of limitation. When your world contains only a few surnames, those names begin to repeat. Cousins married cousins, uncles married nieces, brothers married sisters-in-law whose blood was already shared. Over time, the family tree stopped branching. It folded inward. At first, the consequences were subtle. A limp passed down, poor eyesight, learning difficulties that were explained away as bad luck or God's will. Children were born smaller than expected, with odd facial similarities that went beyond normal family resemblance. The same narrow jaws, the same uneven eyes, the same fragile bones. People noticed, but they did not speak openly. In communities like this, silence was survival. Doctors were rare visitors, hospitals even rarer. Births happened at home, deaths happened quietly. Records were incomplete or non-existent. What could not be explained was ignored. What could not be ignored was hidden. As generations passed, the defects became harder to conceal. Infants were born with malformed limbs. Some could not walk, Others could not speak. Many died young. Those who survived carried visible markers of genetic collapse: crooked spines, asymmetrical faces, underdeveloped organs. Fertility problems became common. Miscarriages were frequent. Stillbirths were mourned briefly, then buried without documenta. Yet the cycle continued. The family developed its own logic, its own explanations. They believed outsiders would not understand. They believed the world would judge them. And they were right. So they stayed within themselves, marrying within the same shrinking circle, unknowingly amplifying the very traits that were destroying them. Scientists would later describe this process with cold precision. Recessive genes, once harmless, began pairing with identical copies. Mutations that should have disappeared were reinforced instead. Traits meant to remain dormant became dominant. Each generation carried more genetic weight than the last, like a structure built on a cracking foundation. The woman at the center of this story was born into that collapse. From birth, she was different, even by her family's standards. Her skull shape was abnormal. Her limbs developed unevenly. One hip sat higher than the other, altering her gait permanently. Her pelvis was narrow and misshapen, a detail that would later horrify doctors. As a child, she was often sick. Infections lingered. Fevers lasted longer than they should have. Her growth was stunted. Puberty came late and incompletely. No one expected her to live long. No one expected her to reproduce. In families burdened by extreme inbreeding, reproduction is often the first system to fail. The body, overwhelmed by errors, shuts down what it cannot sustain. Men become infertile. Women fail to ovulate. Hormonal systems malfunction. Nature, in its quiet cruelty, attempts to end the line. That is why her pregnancy would later be considered not just rare, but obscene to biology itself. But before that moment, before the impossible conception, there were signs that something in this bloodline was behaving unpredictably. While many relatives were sterile, others reproduced with alarming frequency. Some children were born seemingly healthy, only to deteriorate rapidly as they aged. Others appeared fragile at birth but survived into adulthood, carrying invisible damage that would emerge later. Doctors who eventually studied the family described it as genetic chaos, not uniform failure, but instability. A system no longer following predictable rules. And instability is dangerous. As records were pieced together years later, patterns emerged that chilled researchers. The same defects reappeared in different branches. The same abnormalities resurfaced decades apart. A malformed jaw here, a fused vertebra there, cognitive impairment recurring like an echo. It was not random, it was inherited. One physician wrote that the family represented a closed genetic loop, a phrase that would later appear in academic papers. In such loops, harmful genes have nowhere to go. They are recycled endlessly, intensified with each pass. The family did not understand this. They only understood survival. They worked, they married, they buried their dead. They whispered prayers over children they knew might not last. And then the pregnancy. When doctors finally learned her lineage, disbelief turned into grim clarity. This was not just a medical mystery. It was the inevitable outcome of generations ignored by science and abandoned by society. The pregnancy was not a fluke. It was the result of a bloodline stretched so far beyond natural limits that even its failures had become unpredictable. What horrified researchers most was not the deformity itself, but the contradiction. Inbreeding was supposed to reduce fertility, not produce it. Yet here was a woman whose body should not have been capable of conception, carrying a child. Some began to question long-held assumptions. Could extreme genetic damage sometimes bypass nature's safeguards? Could systems meant to fail instead mutate into something unstable but functional? Was this pregnancy proof that biology does not always choose mercy? As more information surfaced, ethical questions followed. Who was responsible for this bloodline's collapse? The family, society, the state that ignored them, the medical system that never intervened? Because intervention could have changed everything. Education, access to healthcare, genetic counseling, none of it existed for them. They were invisible until they became impossible to ignore, and when they were finally seen, it was not as people, but as specimens. The woman's pregnancy forced doctors to confront a truth they were uncomfortable, admitting science had failed these people long before biology did. Generations of warning signs had gone unnoticed. Each malformed child was a signal, each early death a message, but no one was listening. And now, the consequences were growing inside a body that could barely contain them. This was not just a twisted bloodline, it was a cautionary tale written over decades. A reminder that when isolation meets ignorance, nature does not always intervene kindly. Sometimes it waits, sometimes it watches, and sometimes it allows something so unnatural to occur that the world is forced to look. By the time doctors stood at the woman's bedside, debating whether her body could survive birth, it was already too late to prevent what generations had set in motion. The bloodline had spoken through her, and it was not finished yet. The night the child was born, even the doctors who believed they had prepared for every outcome realized how unprepared they truly were. Nothing in their training, nothing in their experience had equipped them for what they were about to witness. The labor began quietly. No dramatic rupture, no sudden emergency, just a slow tightening in the woman's body, the kind that would have gone unnoticed in another patient. But this was not another patient. Every contraction placed impossible pressure on bones that were never meant to move this way. Her pelvis, already malformed, resisted the process entirely. Hours passed, then more. The pain did not follow normal rhythms. It came in uneven waves, unpredictable, sometimes stop, ping entirely, then returning with terrifying force. Doctors watched her closely, expecting collapse at any moment. They monitored her breathing, her pulse, the faint but persistent heartbeat of the child trapped inside a space that biology had never designed for birth. Each minute that passed felt borrowed. Each breath sounded like it might be her last. When it became clear that natural delivery was impossible, panic set in. Surgical options were limited and dangerous. An operation that might save a healthy woman could kill her instantly. Infection, blood loss, shock, any one of them could end everything within minutes. Yet doing nothing meant certain death for both mother and child. The decision was made in fear, not confidence. What followed was not a clean medical procedure, but a desperate intervention carried out with trembling hands and silent prayers. The room was tense, heavy with the understanding that history was unfolding, and that it might end in tragedy. Then, against all odds, the child emerged alive. There was no cry at first, just a stillness so complete that the room seemed to stop breathing. Doctors leaned in, searching for movement, for color, for any sign that life had survived the journey. Then the child inhaled. The sound was weak, strained, but unmistakably human. A gasp pulled from lungs that should not have existed. Life asserting itself where science had predicted failure. But relief lasted only seconds. As the child was lifted into the lie, the silence returned. This time deeper, heavier, filled with dread. What lay in the doctor's hands was not simply a newborn. It was the physical record of generations of genetic collapse written into flesh and bone. The child's body was small, alarmingly so, even for a premature birth. The head was misshapen, the skull uneven, with features that did not align as they should. The face carried an unsettling familiarity, traits repeated too many times across the bloodline. The eyes were set at an unusual distance. The jaw was underdeveloped, limbs appeared fragile, their proportions slightly off, as though assembled without a clear blueprint. No one spoke. Doctors exchanged glances they would never forget. This was not just abnormal, it was unprecedented. They worked quickly, checking vital signs, clearing airways, stabilizing what could be stabilized. The child lived, but barely. Breathing was shallow, the heartbeat irregular. Muscles responded slowly, as if unsure whether to function at all. And yet, life persisted. The mother, exhausted beyond comprehension, drifted in and out of consciousness. She never saw her child clearly in those first moments. Whether that spared her or robbed her is something no one could later decide. Medical staff documented everything: measurements, observations, photographs, notes written with hands that shook despite years of training. Words like severe, extreme, and unknown prognosis filled the pages. Some descriptions were clinical. Out. Hers betrayed emotion no textbook could contain. One doctor wrote later that it felt less like delivering a baby and more like witnessing the consequences of time collapsing in on itself. The child was rushed to intensive care, separated from the mother almost immediately, not out of cruelty but necessity. The baby required constant monitoring, oxygen support, feeding assistance. Every system was fragile, every function uncertain. Hours passed, then days. Against expectations, the child did not die. This survival unsettled the medical team more than death would have. A stillborn infant would have confirmed their assumptions. A life struggling forward demanded explanations they did not yet have. As the days went on, more abnormalities became apparent. Reflexes were delayed, muscle tone was weak, developmental signs that should have appeared quickly did not. Doctors began to understand that survival did not mean health. This child would not simply grow out of these conditions. Geneticists were consulted, specialists arrived, blood samples were taken, family histories were reconstructed in grim detail. The child became a living case study, discussed in hushed tones, examined repeatedly, analyzed from every angle. But beneath the science was something harder to face. This child was not a mistake of nature. It was a product of neglect, of isolation, of generations left to collapse inward without guidance, without intervention, without help. The public would later hear fragments of the story, stripped of context and compassion. Headlines would reduce the child to a label, a curiosity, a warning. But inside the hospital walls, the reality was more complex and more disturbing, because the child was aware. As weeks turned into months, doctors noted moments of recognition. The eyes followed movement, hands reacted to touch. The child responded to voices, even if slowly. There was intelligence behind the abnormalities, limited perhaps, but present. This complicated everything. If the child had been unresponsive, the case might have ended quietly. Instead, it forced questions no one wanted to answer. What kind of life awaited someone born from such extreme genetic damage? Was survival a blessing or a sentence? The mother, when she recovered enough to ask, wanted to see her child. The moment was brief and carefully managed. She looked at the baby not with horror, but with recognition. This was her blood, her family, her history made visible. She reached out, trembling, and touched the child's hand. Witnesses would later say that was the moment the room finally exhaled. Not because things were okay, but because the story was no longer just medical, it was human. The child lived, not easily, not normally, but undeniably alive. And with that life came consequences far beyond one family or one hospital. Researchers would study this birth for decades. Debates would follow. Ethics would be questioned. Policies would be reconsidered. But on that day, in that room, all of it faded behind a single unsettling truth. A child had been born who should never have existed, yet did. And in surviving, that child forced the world to confront the limits of biology, the cost of silence, and the terrifying reality that nature does not always stop us from destroying ourselves. Once the child survived beyond the first fragile weeks, the tone surrounding the case shifted in a way that few inside the hospital were prepared for. What had begun as fear and disbelief slowly transformed into something colder, sharper, and far more dangerous: scientific obsession. The child was no longer seen only as a patient. It became a subject. Doctors who had never met the family requested access to records. Letters arrived from universities and medical institutions across the country. Specialists wanted photographs, measurements, blood samples, skeletal scans. Some spoke with genuine concern, others barely disguised their excitement. S was not just a rare case. It was a biological anomaly that challenged decades of genetic theory. Meetings were held behind closed doors. Charts were spread across tables. Family trees were reconstructed with grim fascination, branches folding inward again and again until they resembled knots more than lineages. Each repeated name confirmed what science already suspected, but had rarely documented so completely. Extreme inbreeding had not only damaged the bloodline, it had destabilized it. The child's survival posed an uncomfortable problem. According to existing genetic models, the pregnancy should never have progressed, and the infant should not have lived beyond birth. Yet here was a living contradiction, breathing quietly under constant observation. Scientists do not fear questions, but they fear answers that undo their certainty. The child underwent examinations that bordered on relentless, reflex tests, neurological assessments, skeletal measurements taken again and again, as if repetition might make the results more comprehensible. Blood was drawn frequently. Samples were preserved, labeled, stored. Some would be studied years later, long after the child's name had been stripped from the files. Ethics committees were either absent or ignored. This was an era when curiosity often outran compassion, especially when the subject came from a family few believed capable of understanding consent. The mother was asked to sign documents she could barely read. She was told T was for her child's care, for medical advancement, for knowledge that could help others. She did not fully understand that her child was becoming a reference point, a living footnote in the margins of medical history. As weeks turned into months, debates intensified. One faction argued the child should be protected, shielded from invasive study, allowed as normal a life as possible. Another insisted that cases like this were too rare to waste. Knowledge, they said, justified discomfort. Progress demanded sacrifice, and the child lying quietly beneath bright hospital lights became the battleground. What unsettled researchers most was not the deformity itself, but the pattern. The child's abnormalities were not random. They aligned with inherited traits observed across the family, traits that had compounded rather than cancelled each other out. It suggested that the genetic system had not collapsed cleanly. It had rerouted. Some scientists proposed disturbing theories, that extreme inbreeding did not always result in sterility or death, but in instability, that biology, when cornered, might produce outcomes that were neither viable nor terminal, but suspended somewhere in between, a state of genetic limbo. Others pushed back fiercely. Accepting such theories meant admitting that existing safeguards, both natural and societal, could fail. It meant acknowledging that without intervention, human populations could drift into states science was not prepared to manage. The chill D became evidence in arguments that extended far beyond the hospital walls. Papers were drafted. Conferences referenced the case indirectly, cloaked in anonymity, but unmistakable to those in the field. The story spread, sanitized for professional consumption, but stripped of its humanity. And still the child lived. Development was slow, uneven, but undeniable. Small milestones were celebrated quietly by nurses who had grown attached, a stronger grip, longer eye contact, a faint vocal sound that suggested awareness. These moments complicated the narrative researchers wanted to tell, because it is easier to study an object than a person. As time passed, attention shifted from survival to prognosis. What kind of life could this child have? Would cognitive development progress? Would physical limitations worsen with age? No one could say. There were no comparisons, no prior cases. The child existed alone in medical history. This uncertainty bred fear. Some doctors worried about public reaction if the story became known. Others worried about the precedent it set. If such pregnancies were possible, should they be prevented? Should families like this be monitored, controlled, intervened upon? The conversation drifted dangerously close to eugenics, ideas many preferred to believe had died decades earlier. Yet here they were again, resurrected by a single birth that challenged comfort and conscience alike. Behind these discussions, the mother watched her child change hands. Exam. Inded, discussed, analyzed. She asked questions that received partial answers. She sensed, without fully understanding, that something had been taken from her, not physically, but something deeper. Ownership of her child's story. The hospital was no longer just a place of healing, it was a stage. Visitors arrived who did not introduce themselves as caregivers. Their language was precise, detached. They spoke of data and variables, of significance and long-term observation. The child's name was rarely used. One nurse would later recall how she began whispering the child's name during feedings, as if to remind the world, and herself, that this was not just a case file. Eventually, decisions were made that could not be undone. Long-term monitoring was approved. The child would be followed, studied, documented for years. Every change recorded, every deviation noted. The justification was always the same: this knowledge could save lives in the future. But no one asked what it cost the child in the present. As the story progressed, fear replaced curiosity in some corners of the medical community. If inbreeding could produce not just failure but unpredictable survival, then the risks were greater than anyone had admitted. This was not just about one family. It was about what happens when society turns away from its most isolated populations. The child was proof that neglect compounds silently until it erupts into something impossible to ignore. By the time the case faded from public discussion, never fully erased, only buried beneath academic language, the damage had been done. The child had been transformed from a person into a symbol, a warning, a data point, and science had gained knowledge but lost innocence. Because in studying the child so intensely, researchers were forced to confront an uncomfortable truth. They were not just observing the consequences of inbreeding, they were observing the consequences of indifference. The child survived biology's limits, only to face humanity's. The years that followed did not bring closure. They brought consequences, slow, uncomfortable, and impossible to ignore. What began as a single impossible pregnancy rippled outward, changing how medicine spoke about genetics, how society confronted isolation, and how science was forced to reckon with its own limits. The child did not vanish into history as many expected, nor did the story resolve neatly into tragedy or triumph. Instead, it lingered, alive, unresolved, and deeply unsettling. As the child grew, development followed no known timeline. Some abilities emerged late, others never fully formed. Physical limitations became more pronounced with age. Bones that had struggled at birth grew under constant strain. Muscles compensated where structure failed. Every movement carried effort. Every milestone came with uncertainty. Doctors documented everything. What they were witnessing was not simply the long-term result of deformity, but the unfolding aftermath of genetic instability. Systems that should have developed in harmony instead worked against one another. Improvements in one area often revealed failures in another. The body was not collapsing, but it was not stabilizing either. And that disturbed researchers more than deterioration would have, because deterioration fits expectations. Instability does not. The child became living evidence that extreme inbreeding does not always end lines cleanly. Sometimes it produces lives that persist in states science cannot neatly categorize, neither fully viable nor immediately fatal, lives that endure. This realization began to reshape conversations in medical journals and policy rooms alike. Quietly at first, cautiously, language shifted. Where once textbooks spoke confidently about nature correcting severe genetic errors, new papers used softer words. Probability, risk, uncertainty. Biology, it turned out, was less merciful and less predictable than assumed. The case forced geneticists to revisit models that had gone largely unquestioned. Recessive traits were not always suppressed. Systems meant to shut down reproduction did not always activate. Under enough isolation, under enough repetition, human genetics could behave in ways that defied tidy theory. And that meant responsibility could no longer be placed solely on nature. Attention slowly turned outward, from the body to the environment that produced it. From genes to neglect, sociologists and ethicists entered the conversation. They asked questions medicine had avoided. What happens when communities are left without education, healthcare, or oversight for generations? What happens when warning signs appear repeatedly and no one intervenes? The child's life became a mirror, reflecting not just biological failure, but societal one. This was not an accident, it was an outcome. As the years passed, parts of the case filtered into training programs and lectures, often anonymized, often stripped of human detail. Students learned about extreme consanguinity and closed genetic populations. They studied diagrams and charts without seeing the face behind them. But those who had met the child never forgot. Nurses remembered the small victories. Doctors remembered the discomfort of knowing too much and helping too little. The mother remembered a child she loved, even as the world debated what that child represented. The family, long isolated, became the subject of scrutiny and judgment. Some blamed them, others pitied them. Few acknowledged the deeper truth, that isolation had been allowed to fester, unchecked, until biology itself bore witness. Policy changes came slowly, unevenly. Genetic counseling programs expanded. Rural healthcare initiatives gained modest attention. There was talk of prevention, education, outreach, but systems moved slower than consequences. Still, the case left its mark. It became a reference point, a cautionary example, cited when discussions turned to the limits of human genetics. When someone argued that nature always intervenes before catastrophe, this story was raised quietly, like an uncomfortable footnote no one wanted to linger on, because the child had survived, and survival complicated everything. It challenged the idea that suffering is always brief, that mistakes are self-correcting, that lines crossed will automatically be erased by biology. Instead, it revealed something far more disturbing. Humans can carry the consequences of neglect forward, generation after generation, until the outcome is no longer avoidable. As the child reached later years, public interest faded. There were no headlines, no dramatic conclusion, just a life lived under constant limitation, shaped by choices made long before birth. Some researchers continued to follow the case. Others moved on, taking what they needed and leaving the rest behind. The child grew older, more aware, more burdened by a body that never truly belonged to itself. And still, the legacy deepened. The story began appearing, quietly, in ethical debates, in discussions about reproductive responsibility, in uncomfortable questions about intervention versus autonomy. Where does help end and control begin? When does prevention become violation? There were no easy answers, but the pregnancy that once defied biology had accomplished something no experiment ever could. It forced humanity to look directly at the cost of ignoring its most vulnerable corners. This was not just about inbreeding, it was about abandonment, about what happens when families disappear from the view of systems meant to protect them, when silence becomes tradition, when warning signs are normalized because no one is watching closely enough to be alarmed. The child's existence stood as proof that biology does not erase our mistakes. It records them, carries them, sometimes it hands them back to us alive. And that may be the most haunting legacy of all. Not that the child was born, but that it took such an extreme outcome for the world to finally pay attention. In the end, the story does not offer comfort, it offers responsibility. A reminder that science alone cannot save us from ourselves, and that when society fails quietly enough, the consequences do not disappear. They grow. They breathe. And sometimes they look back at us, asking what we chose not to see until it was too late.